My name is Trish Ware, and I am obsessed with all things pregnancy and birth, and helping you to navigate both the practical and the magical seasons of this journey called motherhood. I'm an all-day coffee-sipping mama of 7. I've had the amazing privilege of delivering many babies in my 15-plus year career as a labor and delivery nurse and as a mama of 7. I'm here to help you take the guesswork out of childbirth so you can make the choices that are right for you and your baby. Quick note, this podcast is for educational purposes only and does not replace your medical advice. Check out our full disclaimer at the bottom of the show notes. Good morning, everyone. Today, I am talking to Stephanie Fritz. She is the Essential Midwife, and we're going to be talking all about gut health and I'm assuming holistic type of things, essential oils. So I'm excited to welcome you, Stephanie. If you could just say hello and tell everyone who you are.
I am just so happy to be here with you, Trish. Thank you for the invite. I am just a quick introduction of me. I'm Stephanie Fritz. I'm a licensed midwife in Arizona, and I am currently residing in Utah. I have 4 amazing daughters, 9 adorable grandchildren, and a husband that I just love and adore of 42 years.
Oh my gosh, I love that. I just love, because I don't know if you listen to me or you know me, but I was in a really difficult marriage for 25 years. And now I'm married to someone who I absolutely adore. So like you gave me chills to hear that. And I love for women to hear that you can really love your husband and your partner.
Absolutely. And I really just have the cream of the crop. When I would go on births at night, because that's when babies are born in the quiet of the night, I would come home and early in the morning, my husband would already be off to work and my bedside would be turned down with a mint on my pillow. So
stop it.
He is just like,
with a mint.
He's amazing. And there's a high divorce rate amongst midwives. And for me, my family and my husband have just been just beyond supportive. We always had a plan B for holidays and birthdays and like Christmas. Now, if mom's not home, if mom's out on a birth, are you okay with waiting for Christmas until she gets home? And we always got the okay with everybody, but there were some vacations missed because I had babies due. And so it was just, again, I have the most amazing family ever.
I'm so emotional listening to you because part of why I do what I do is because the majority of people in OB and obstetrics and delivery make it fit their life. And part of the reason, so my labor and delivery nurse was the reason. She inspired me. She was amazing. I had my oldest when I was a teenager, and I thought my life was over. I went to a very private prep school on a path for college. No one I knew had ever gotten pregnant. And I get pregnant. I had already been accepted into colleges, and I thought my life was over. This is a short, long story, maybe. I don't know. My labor and delivery nurse, after I delivered, leaned in and she said, "You have so much ahead of you. Your life is not over. You can do anything you want." And here I am. I had 4 kids by the time I was 25, okay, mind you. And I own my own businesses, 2 of them. I'm very successful. Her name was Laura Berry. That was a very long time ago. And eventually, even though I waddled across the stage as a labor and delivery nurse as a nurse to get pinned, sat for my boards on Friday, had my daughter on Monday, and started my nursing career, my labor and delivery career the year later, I quickly realized that my dream of being a midwife, I couldn't do it because I could not be one of those midwives who would schedule everyone inductions so I could have a life.
Yeah.
And there's very few people. I told you guys this was a long story, so bear with me. There's very few people in this field. Maybe home midwives are different, but there's very few people in this field that preserve the natural process of birth for the moms instead of trying to make it happen for themselves. Wouldn't you agree?
100%, 100%. When I first got started as a midwife, I was young. My first baby was, we were still in college. I was young and super excited to have this baby. And I went to the doctor, and of course, I was contracting. And he says, "Yep, you're in labor. Go pack your bag, head over to the hospital, and don't rush, but you're going to have a baby today." I have waited 9 months for this. I am going to rush. I ran home and packed my bag, and we're at the
Yeah.
hospital. Really, my body just wasn't ready. And I went through 36 hours of really hard labor, all natural. And then after that, I thought, there's got to be a better way. I do not want to do that again. And so when my second one came along, we were still paying for the first one. And a friend of mine said, "You ought to look into a midwife. They're a lot cheaper." And so originally it was for financial reasons that we went with a midwife, but
And
soon
a home birth
a home birth
midwife.
midwife,
Okay.
yes. And I remember being in my first visits with her and thinking, "Oh my gosh, this is what I am called to do." I get emotional as I even say that because I remember that moment
Now you're making.
and knowing
Mm.
that this is my mission. This is what I'm supposed to do. And I'm supposed to take note of every single thing because I want to do it just like her. And
Mm.
that was in 1984. So
Mm.
of course, I was a young mom. We were in the military. We moved all over. So I did childbirth education and taught classes and was invited to births. And it wasn't until the 90s that I decided that I needed to pursue and get legal as far as go through the licensing process as far as
Mhm.
being a midwife. And I just have never looked back. I love, love, love what I do. And I come away from a birth at 7:30 in the morning when there's a hustle and bustle out. Kids are going to school, people are going to work. And I drive away from that house thinking, wow, nobody has any clue the miracle that just happened in that house. And I'm just in awe.
Yeah, I love that so much. And I tell my students and my coaching clients, because a lot of my coaching clients are labor nurses or childbirth educators or doulas, or I have a midwife who is now specializing in tongue tie, which oddly enough, but I've told them the same thing. I every birth that I've experienced, and you see the way the baby's head moves the same as all the other babies that you've seen, and you've seen just the beauty of the natural process of birth. If it doesn't take your breath away each time, you are not paying attention.
Yeah, for sure.
Because it's just insanely miraculous. Like I remember like my first couple of births that I was off of orientation as the labor nurse. And I remember just someone being like, Trish, get your job, go work. Cause I'm like, oh, and crying. I've cried at so many births. It truly is. And if we could just get the system to remember that this is a natural process, because although I wish I wanted to have a home birth with Grayson so bad, I had him at 42. He's baby number 7. I've had 6 I've delivered. 1 is adopted. And I was planning a home birth. I'm like, I'm doing a home birth. I'm doing it. But I ended up having 3 losses before I got pregnant with him. And then I was on heparin. And it was like, I was being baby number 6, already a risk at hemorrhage. And I'm on this. I was going to deliver at Ina Mae Gaskin's farm, which was like a dream, but it wasn't to be. But anyway, I told you we're going to go off on tangents. This is how it works.
This is all here. Good. I'm loving this conversation.
What I'm really like, I know we have some questions we talked about, but I would love for you to just share with the mamas listening that maybe, because I think there's a lot more moms that have a secret desire that they want to have a home birth, but they're really afraid of what people will think. They're afraid of it. What if I want you to say, what are some like key things that you think are important for women who are considering a home birth? What questions can they ask themselves or consider that it might be a good fit for them? Does that make sense?
Yes, totally. And I want to start out with a little analogy that I just heard from Dr. Stu. He is an amazing OB that teaches midwives and about breech birth. And
I
he
know who he is. Is he in North Carolina by chance?
No, actually.
Okay, I'm thinking of someone else. Okay.
He may have been, but now he's not.
Okay.
But anyway, I loved what he said. He said, when you get married, you have a wedding planner, you put out all this money for the perfect wedding. You get to pick out your flowers, your cake, the color of your napkins, everything. And thousands of dollars are spent on your wedding to have just the perfect one you want. Because in a woman's life, her wedding is one of the most important dates of her life. Another one is her children, the birth of her children. And so now we fast forward to birth, and because they have insurance, they just take what is available. And you don't get to pick and choose all the things that you would want to have that perfect birth. You just have to go with what's provided. And so you miss out on one of the most amazing moments of your life because you just went with what was provided. Think about if you had insurance for your wedding and you just went with what was provided there and you didn't get to.
So McDonald's is provided for your reception dinner.
Right. And so
yeah.
He was talking about how the insurance really just guides you which direction you go in. And a home birth is certainly not for everyone, but if you have that desire, even if you have insurance, it's worth looking into that, because by the time you pay your copays and your premiums and all that, a home birth really isn't that expensive. Often it's cheaper. So in my case, it certainly was. But so anyway, just think about those things. And then I would recommend to interview with midwives and find one that you resonate with. I personally interviewed with 4 different midwives and found the one that was just perfect for me, because you are sharing the most intimate experience of your life with this person. I am best friends with my clients. Still to this day, I have just dear friendships with my clients, and I have not only delivered their babies. And so that's just
That's
I
amazing.
look back and think, yeah, what an awesome experience I have been given.
I love that so much. And I also want to speak to you guys about for the choices, like Stephanie is saying, insurance does make some choices for you, but you also, even if you're having a hospital birth, I don't want you guys to think that you can't still plan out the wedding because you can. And I use this almost the exact same analogy down to what they're wearing during birth. Because a lot of them will say, I used to sell labor and delivery gowns. I still have some. I had a seamstress, but she went back to college. But I used to say it's a special event, because people would be like, can I get the blood out? Who cares? It's a special event. It's okay. It's this one event. But I do want you guys to know that maybe having a home birth isn't in your plans, but I think the same holds true, that you still have a voice and choices, and even down to the lighting in the room, the conversations that are being held. But I do 100% teach my girls to stay at home as long as possible. And funny enough, you'll appreciate this, the majority of my students who tell me about their births, because I have thousands that never communicate, but every week we hang out on Zoom to help them with the mindset and like implementing. The my students' average centimeter that they are when they get to the hospital is 7 to 8 centimeters.
Wow, that's amazing. That is
Yeah,
amazing.
because being at home, you just don't perceive, and they aren't getting there freaking out. They're getting there still wondering, are they going to send me home? Because when you're at home, and I think this is what I love most about home birth, when you're at home, you're calmer. And some people probably shouldn't have a home birth because it might not be a good situation for them. But laboring at home, giving birth at home in your safe place allows the oxytocin to flow and everything to go smoother.
I agree with that. Yeah, 100%. One of I love what you said about you having choices, because that's one of the things that I really try and empower my moms with is don't turn your power over to me or anyone else. This is like, you are hiring your doctor, you are hiring me, and I just want to be a I just want to be a lifeguard there, just to watch and guide. And I'm here to help you have the best birth that you can have. And you can have that in a hospital as well. You have that power. If there's something you desire or you want, you stand up for that. And in labor, sometimes that's hard to do. And so that's where your doula comes in, and or another support person where they can help you navigate those desires.
Yeah. That's exactly what I tell my girls. I'm like, okay, during your pregnancy, you and your birth partner, your support person has to get as educated as possible. You have to explain to them what it is you want and why you want it. And I teach them all about interventions, when they're necessary, when they're out of convenience, what have you. And because I tell them, when you're in labor, your only job is to labor. At that point, it's your partner's job to advocate and to speak up and to refuse or accept or whatever. But so I also wanted to talk to you because I know that when we were connecting, that you do a lot about fertility, conceiving, and gut health and essential oils. So I'd love to hear, like, how did you fall into that, and how does that play into your own relationship with your clients?
I used to see clients when after they saw the double line on the stick. That was the
Hmm.
majority of my clients. They would call me after they were pregnant, and then we would proceed from there. And now, over the last, since 2019, probably, I see more clients that are trying to conceive, and that has totally flipped. So I just fell into that, where I still support many pregnant women by all means, but a lot more than I used to on the fertility side. And so just trying to make that connection between the gut and your microbiome and digestion and nutrition and all those kinds of things, connecting that to fertility has been such a eye opener and has helped so many people be successful, so many mamas be successful with getting pregnant and staying pregnant.
I love that. So when now, do those moms always play into becoming a home birth mom with you, or is it more like this is something separate?
This is something separate. Some do, but mostly they're just so happy to get pregnant, and then they're on their way. And of course, I'm there for them to help them throughout their pregnancy. But no, not most of them actually continue on with their wherever they are, because those are virtual clients where they're not within my local community that I could serve in a physical way.
Okay. Okay. So that's more like they connect with you online or what have you.
For sure. Yes, I do personal consults where we devise a plan that's absolutely personal for them. And whether that's pregnancy, postpartum, or before even trying to conceive.
Oh, I love that. Okay. So that is so interesting. I feel there's so much to be learned about gut health in general.
For sure.
You get, oh my goodness. Like I have a coaching client who's a naturopathic doctor, and she focuses on new moms postpartum. And we were just having a conversation about this exact thing. So another thing I wanted to ask you about, because I get asked this all the time, is about essential oils. And so I wanted to talk to you about essential oil use during pregnancy. And then I know you had said something about like top complaints and essential oil. So I was just wondering if I could fire off some different things that I hear all the time, and maybe you could give us some pointers on essential oils. But I figured you should probably like talk about the safety of them and what they should know before they start using essential oils.
For sure. So you're going to see a lot of mixed information out there in different books about oil safety and their throughout pregnancy and with your newborn. But please understand that these books were written with all oil users in mind. So they're going to be ultra conservative because they don't know what kind of oils you're using, whether they're how many tests have been done on them, if they have pesticides or fillers or all the things that essential oils can be filtered with. So,
Okay.
just so you know, the information that I give in my book and that anything that comes from my social media or from me speaking comes from my personal experience in my midwifery practice and conversations, many conversations with my backup docs. So, during pregnancy, we do need to be very protective about what we put in our bodies, but essential oils can be very safe and effective. And it's my intention to help you to know how to use them with confidence. We can have extra sensitivity in pregnancy, so you might want to use a little less or dilute a little bit more. But really, in the end, it's all about using common sense and your intuition. There are a few that I recommend to avoid during pregnancy, like clary sage. Clary sage is super relaxing and calming and soothing. It's great to help you if you're one of those people that don't have a problem going to sleep, but you wake up at 2 or 3 in the morning. That's a hormone thing. And so clary sage, a drop of clary sage under your tongue before you go to bed will help you be able to sleep through the night. But in pregnancy, that clary sage can strengthen contractions. And we don't need that, even for Braxton Hicks. So in general, I recommend avoiding that until your full term. And then after that, you can use it all you want. But there are other oils that can accomplish that same calming, soothing effect without using that specific oil.
Okay, so let's start in like complaints during first trimester. What do you recommend?
First of all, when you're first pregnant, the first complaint is morning sickness and nausea. So I like to put oils in categories. So we have a digestive category, a pain category, relaxation category, etc. And some of the oils will cross over into each different categories. But if we're looking at the digestive category, then you would find peppermint, ginger, fennel. For let's see, copaiba is a great one. Cardamom and ginger come from the same family, and they actually block your nausea receptors. Back in the day, your mom might have given you ginger ale to help with if you felt nauseous. That's because of that ginger in that ginger ale actually does block those receptors. And those oils like ginger or cardamom, copaiba, those put behind your ears, behind your neck, on your pulse points, wherever you would put perfume. That's a great place to
Okay, I'm
put
so
them.
glad you weren't going to say a drop under your tongue, because I was very sick when I was pregnant, and I was already feeling a little nauseated thinking about that.
For sure. So you could put it in a tea, but only if that is helpful. Only if
Yeah.
that is, for
I
me,
think with morning sickness, there ain't nothing going in your mouth.
all I had to do was put it under my nose and just smell it, and it would give relief. Another complaint is your round ligaments. So you have two ligaments that going from your groin area all the way up on each side. And when you're first pregnant, those are about the size of your pinky, as round and as long as your pinky finger. But by the time you get to third trimester, they're as long as a pencil and as thin as a pencil lead. And so you can imagine just rolling over in bed or bending over to pick something up might strain those. So oils that I might recommend for that is cypress for circulation, Siberian fir for pain, and copaiba for pain and inflammation. And you would just put a drop of each of those in your hand with some carrier oil. I like fractionated coconut oil because it's virgin coconut oil with the fats removed, so it stays in a liquid form and it doesn't go rancid and it doesn't smell. And then you would take that and just massage that on whatever side of that ligament is strained. Another ailment of complaint that you might have is that sciatic nerve runs from your low back all the way down to your foot. And sometimes that can be strained even by baby's position. And so helichrysum, lavender, marjoram, and Roman chamomile help with that. And it just helps with that nerve discomfort, the pain, the muscles that are supporting that nerve, all of that will help that. And then, of course, stretch marks to help with the stretching of your tummy. And there are oils to help with that, like copaiba, sandalwood, cedarwood, frankincense, and myrrh. And putting those in a drop or two of those in your hand with some carrier oil and massaging that over your tummy every day can help with that, just that discomfort of stretching.
I love that. That's amazing. What about for sleep? Because you said not to use clary sage, which I teach my girls to use for labor, but what would you recommend for them if they, so let me actually ask you, I have a good friend here in Nashville who's pregnant, and she sent me a list of things going on with her right now. She's got insomnia to the point where she's losing her mind, and restless leg syndrome, and nerve pain, like in her feet.
Mm-hmm.
And we gave her some tips, but I would love to hear what would be some recommendations for any of that at all, if you have any.
Absolutely. So for sleep, lavender is great for sleep. But sometimes lavender, again, let's go back to those categories, and there's lots of relaxation oils in that category. So we have lavender, bergamot, Roman chamomile, copaiba, those are just to name a few, petitgrain. And if one of those doesn't work, then try another one. If you had to have an antibiotic because had some sort of infection, you had to have an antibiotic, and you go to the doc and he gives you that, and you come home and use it for 2 or 3 days, and it's not helping. You don't throw your hands up in the air and say, I guess I'm just going to have this forever. This isn't working. You call your doc back and say, this isn't working. He says, oh, let's try something else. And so the same with essential oils. If one isn't working, then just let's try another one in that category. My own grandkids, I have 3 little granddaughters in Georgia, and 2 of them, lavender will put them right to sleep, but the other one, it makes her hyper. And so she uses petitgrain, and that will work instantly. And so those are some oils that can help with
And how
sleep.
how do you do that?
You would put them again on your perfume points, on your pulse points, or the bottoms of your feet is a great place to put essential oils because they get absorbed through your feet all the way up into every cell of your body. So that's a great place to put them.
And straight, just do that straight, those oils?
I would always use a carrier oil just because even for something as mild as lavender, because a carrier oil not only dilutes for sensitive skin, but it also helps the oils last longer. So if you didn't use a carrier oil, you would have to be reapplying every few minutes. But a carrier oil slows down the absorption of that oil so that it lasts for a much longer period of time.
Interesting. So what about restless legs? I hear this one all the time. Yes. Do you have any tips?
Yes, for sure. So
I mean, I know what we tell them, but I'm interested in what you would tell them.
So magnesium is a big one for restless leg, and so extra magnesium. And most of us are deficient in that. Anybody could take extra magnesium, but also as far as essential oils, there is cypress is great for circulation. And I have a blend that I use that's called Aroma Touch, and it is like a massage in a bottle. It's from doTERRA, and that's the brand that I use. And I love that. It works so great for those restless leg. You put a couple of drops in your hand, put some fractionated coconut oil in there, and then just rub that on the leg area, especially like for growing pains, even for your little ones. That works amazing.
Oh, wow. That's interesting to know. Yeah. Of course, I told her magnesium lotion is
Hmm.
what I recommended. So, with magnesium lotion, could you drop the cypress into that, or would you?
100%. Absolutely.
Okay.
Yes, that would be a good
Interesting.
carrier for that.
That's amazing. So, I know we're running out on time and we've had such a wide range. Such a wide range. What about, let's talk about just a little bit, what specific oils or blends do you recommend for moms for recovery and mental health? And I've got a lot. So we have our pregnancy classes. Everyone who joins gets 30 days free in my Mama Hub called Mama Society. And then we support them through postpartum, because you and I both know that's non-existence in real life. We've really been able to go on a journey. I just started doing that a year ago because I hang out with my moms every Wednesday on Zoom, and they were all having babies. And I was like, I don't want you to leave. So we started the postpartum side of it. But in that, as a labor and delivery nurse, because I don't spend time with people postpartum, I have spent more time in the last year to two with moms after delivery. And I would say the two things that I notice the most is anger and rage that they're dealing with, or increased like OCD type of anxiety, like where they're just obsessive about the safety of the baby or something bad could happen or what have you. So I would love to know like your thoughts on different blends or oils that you would recommend for some of these moms.
Yeah, so for postpartum, I think when we support moms uh, for the postpartum part, then they can feel more confident and can have an easier time, not even right after postpartum, but even like right after birth, but even further on down the road. But first of all, like right after birth, you get those hormone shakes, and clary sage is a great oil to help with those hormone shakes. And then we have those after pains. So Siberian fir, lavender, and copaiba are all three great oils for those after pains, that our body is really doing what it's supposed to do, but you've already birthed the baby, and you got your gift with your baby, but now you've got these after pains that are, you don't get anything after that. And we want to support moms with that. And then I always say day 4 is the hardest day for mom postpartum, because she's home from the hospital, her milks come in, often dad has to go back to work, maybe mom has left. Everybody's life has been gets to go back to normal except for hers. And hers has changed forever. And so wild orange is one of those oils that is a happy oil, and it helps mom to be able to let go of anxieties and help give her the support that she needs on that day 4. Day 4 is a day I tell dads that this is a great day to have flowers delivered. This is a great day to do a foot massage, because day 4 is hard. And so wild orange is just a great oil to either diffuse or apply on those pulse points, all the things. But day 4 is just a hard day. And then for later on down the road, I have a blend that is wild orange and Melissa. So 20 drops of wild orange and 5 drops of Melissa in a 5 ml bottle, and then fill to the top with fractionated coconut oil, or a 10 ml roller bottle, excuse me, and fill to the top with fractionated coconut oil. And that mom would just use that on pulse points as needed for just for support for that anxiety, for that OCD that you were talking about.
Okay, so this has been such an interesting conversation, and I'm so happy that you guys have been here. Hopefully you've stuck to the end to listen, because we've covered such a huge weird range of topics, but that's okay. That's how we roll around here. So thank you so much for coming today, and I would love for you to share with everyone where they can find you.
Absolutely. So I am on social media anywhere you look as The Essential Midwife. So that's Facebook, Instagram, TikTok, all the places. My email is even theessentialmidwife@gmail.com. So I'm The Essential Midwife. And you can find all sorts of goodies on my website. Even I have some resources to help with, again, fertility, to help with pregnancy essential oils for pregnancy, birth, and babies, for postpartum, all the things. I have a book that I've written, essential oils for pregnancy, birth, and babies, that I've sold over 100,000 copies. So it's a great resource. And women's hormones are a big deal in that, gut health. So you're going to find all sorts of resources on my website.
I love that. Thank you so much for coming today. Hey mamas, I hope you enjoyed this episode with Stephanie. We really talked about a lot, but what I love the most is her genuine awe of birth. Like that's a birth nerd right there, just like me. Okay, you guys, as always, I will see you again next Friday. Please leave a review. Tell me what you want to hear more of. And also tell me what you loved about this episode. Hit subscribe and I'll see you again next Friday. Bye for now.